6, 5, 4, 3, 2, 1, 0. So, good morning, good afternoon, good evening, depending on which time zone you're in. My name is Christopher Drake, and I'm very privileged to have the opportunity to give you this presentation about the method of Professor Buteyko. This talk is primarily dealing with asthma, and what I can say from the outset is that there's no reason for any person to have to sustain the symptoms of asthma. With Buteyko's method, you can overcome these symptoms, because it was Professor Buteyko who actually understood the real cause, the real underlying reason for asthma. I guess the first thing is, what is asthma? Now, if we look to mainstream medicine, if we look to official medicine, despite the tens of millions, or I guess now it must have accumulated into the hundreds of millions of dollars worth of research into asthma, according to the official medicine, there is no known cause. Officially, there is no scientific explanation for asthma. But Professor Buteyko did provide and produce a seriously technical and scientific explanation for asthma. Professor Buteyko claimed that the reason why people develop asthma is because they breathe too much and too deeply. They breathe above what is physiologically recommended. He went on to claim that any person who breathes within the medically recommended norms, the recommended physiological norms for ventilation, cannot have asthma. He claimed this because, according to Professor Buteyko, asthma is not a disease as such. It is in the category of conditions that were known as the diseases of civilization. These are conditions which somehow develop within the human organism. They are not contagious, and nor are they congenital. Now, if you have the genetic predisposition towards asthma, the only way that you can actually develop symptoms is because you breathe too much. Now, given the fact that we breathe 20 to 30,000 times a day, you only have to breathe a little bit too much all the time for that accumulative effect to result in total an accumulated massive hyperventilation. As I said, according to Professor Buteyko, and which is consistent with what we have seen over the last 2 decades dealing with people who do have asthma, is that when their control pause, which is a measure of their breathing, normalizes or moves toward a more normal level, they don't have asthma symptoms. Asthma is a defensive mechanism, because if we breathe too much, if we breathe sufficiently more above the physiologically recommended norms, what happens? We lose carbon dioxide. The body loses carbon dioxide because of hyperventilation, too much breathing. As a consequence, the body wants to keep this carbon dioxide. It wants to hang on to its carbon dioxide. So it creates constriction of vessels, tightness, the typical asthma symptoms. Now, some people, they hyperventilate, they chronically overbreathe, but they don't have asthma. And that's because they don't have the genetic predisposition to defend themselves against hyperventilation with the asthma symptoms. Did you know, for example, that historically, and this is according to medical journals, there were no reported deaths from asthma until they began to treat the disease with symptomatic medications. A symptomatic medication is a medication that addresses the symptoms of the disease, not the cause. So let's roll back for a minute. What is the cause? Too much breathing, and the body responds by tightening and constricting the vessels so it can keep in its carbon dioxide. Now, take a symptomatic medication, Ventolin or any other kind of bronchodilator. What happens? The organism loses CO2, the body's defense mechanism is defeated, and later it comes back even stronger. The asthma attack will get stronger. And so the stronger the bronchodilating medication, the stronger the asthma symptoms will become. Around 20 years ago, a little over 20 years ago, I was involved with medical centres in Sydney, Australia. And I was introduced to an unusual Russian chap, and he practiced breathing technique of his professor, and I very much liked him and thought he was very interesting, but I did not take seriously his claims that he could treat asthma, allergies, diabetes, and all these kinds of very serious conditions. But I did try to support him a little bit, and I did try to organize some students for him under the impression that, well, he's got some breathing technique, and you know, maybe people will feel a bit more relaxed or a bit better if they breathe a little better. I did not think for a minute that a breathing technique could solve or significantly change the biochemistry of an organism and reverse diseases like asthma or allergies or angina or high blood pressure or diabetes, bronchitis, and so forth. It seemed like just ridiculous to me. But getting back to when I was supporting him and trying to help him get a few students and so forth, I got the feedback from these patients, from his students, that they had overcome their asthma, that they were no longer requiring insulin, or their blood pressure had normalized, or they had lost some kilos of weight, or so many other things. And I was very shocked and surprised. So I then requested that if Alexander would be so kind to bring Professor Buteyko's documentation and masses of highly technical biochemical analysis and papers that were written and the results of various trials, all written in Russian, arrived in Sydney. We went through them all, had them translated, and I realized that this actually was a very, very serious and very fundamentally scientific approach to reversing chronic disease, and not some warm and fuzzy, friendly, natural breathing technique merely to make someone feel a little better. That this had real serious implications and had a great effect on the human organism. And that's because even though the Buteyko method focuses on the breathing, it's not the action of breathing which reverses diseases. It's the result of breathing, the way that we breathe. So the way that we breathe affects our biochemistry enormously. And don't forget, we breathe 20 to 30,000 times a day. Now think for a moment. If you and I were doing some kind of financial transaction, and in each transaction you lost, or I lost, 5 cents, it wouldn't really matter, because you can't buy anything with 5 cents except another 5 cents. But what if we did 20 to 30,000 transactions a day, and on each transaction you lost 5 cents? Well, you can do the multiplication yourself and realize that you are losing thousands and thousands of dollars a week just because you're losing 5 cents. The fundamental idea behind Buteyko's method is that there is 10 times more oxygen in the air in which we live than our organism requires, physiologically speaking. There's no debate on this. This is just a physiological fact. Also, our organism requires around 7%, roughly 7% of carbon dioxide to function properly. And yet, in the air in which we live is only 0.035%. That means there's 200 times less carbon dioxide in the air in which we live than what our organism requires. So basically, our organism develops carbon dioxide because we are 200 times, we should be 200 times richer in carbon dioxide than our environment. And what's the result if we breathe more than we should? And if we breathe 20 to 30,000 times more than we should, our breathing pattern is too much and too deep, and as a consequence, we lose carbon dioxide. Is that coming through on the picture there? Yeah. Okay. Breathing too much means we lose carbon dioxide. And the organism, in the case of asthmatics, it wants to keep this carbon dioxide. It wants to retain this carbon dioxide. And let's not forget that throughout history, hundreds of years ago, people didn't die from asthma. Not only did they not die from asthma, they had the tendency to outlive their contemporaries. Why? Because they had a defensive mechanism which, when they ventilated too much, the body understood what to do, tightened their vessels, constricted them, gave them a miserable time. You're not happy, and you can't run around being relaxed if you're having tight chest and you can't breathe properly. But the organism is happy because it's keeping its carbon dioxide. And then, as a treatment, they began to give people symptomatic medication. Brilliant. Opens up the airways, makes you more relaxed, you can breathe again. However, because of your hyperventilation, you're losing carbon dioxide, and the organism now develops chaotic patterns of metabolism. Adrenal function is disturbed, the potential hydrogen of the organism is disturbed, and it tends toward alkalosis and so forth. A whole range of a cascade of problems occur, health problems occur because of a loss of carbon dioxide. So Buteyko's method for the treatment of asthma is to reduce your breathing, to retrain your respiratory center so that you can comfortably breathe less and less. Is it easy to learn, and is it easy to practice? Well, if you have very mild asthma, no medications, get a little bit of a blocked nose, a little bit tight from time to time, and you're young and otherwise healthy, yes, it is easy. I guess in 3 or 4 days, you can be completely free of asthma, regardless of the dogs, the cats, the birds, fur, allergic reactions, and so forth. If, however, you've had asthma for many years, the organism, some homeostasis has developed around it, and for years you've been taking powerful bronchodilating drugs and having to supplement your adrenals with oral steroids and so forth, then it's much more work, much more difficult. But still, you can see results within days because you can even learn how to overcome asthma attacks. With Buteyko method, those serious and those not yet skillful in completely changing their breathing can at least, through Buteyko's exercises, overcome tightness, wheeziness, and so forth, using Professor Buteyko's breath-holding techniques. So, to answer simply, is Buteyko method easy? Well, it's easy if you don't have far to go, if your condition is relatively mild. It's more difficult. It may take a few weeks of work if you want to overcome very serious asthma. But all kinds of asthma, regardless whether you just take the occasional puff of Ventolin, or even if you require hourly nebulizers and 50, 60, and even more milligrams of prednisone a day, you can reverse your symptoms, period. We did trials in Australia. Now the reason why, it's a very funny story, the reason why we did trials in Australia was because, well, it started off in Australia and in many countries of the world. You can't make claims about the treatment of disease unless you're a medical doctor and unless you are giving treatment along the medically recommended lines. So I wanted to support Alexander Stelmatsky's work, but I didn't want to go to jail either. So we were sort of discussing this problem with Professor Buteyko. How could we introduce his method to Australia so that people can overcome their diseases using his techniques and so forth? And Professor Buteyko said, you should treat asthma. And the reason why you should treat asthma is because just a few days, the patients feel better. Now, if the patients feel better and see improvement, we're off again, are we?
We're back on, but it's going on and off.
Oh dear, you should go to my room.
Back, go. Just try to go.
Sorry about that. Technical difficulties at the... Professor Buteyko said that if the patients are feeling dramatically better within just a few days, then they'll be reluctant, anyone will be reluctant to prosecute you because the patient is better and they're happy, and the fact that you no, I have still...
Just leave the screen for a bit.
Okay.
And then
I'll go and turn my computer off.
Yeah.
How's it going now?
Just keeps on going off and on. I don't understand how or why. Everything's perfect, so it doesn't say it's dropping here.
Okay. What do I do?
Just
Am I on or not?
go for it, yeah. Go on.
Okay. Anyway, let me recap. Professor Buteyko said that... gone again, is it?
Okay, I'm gonna just stop it and start it again.
Okay.
That's about everything.
All right. Technical difficulties here at Buteyko TV. Should I continue?
Okay, you're on. Go.
Okay. Well, let's try again. So, Professor Buteyko advised us that we should treat asthma, and we should focus our attention on asthma because results are so quick that even if the authorities, medical doctors or whatever, get their noses out of joint, it's too late. The patients feel better, they're getting good results, they're not using so much medication, and they're overcoming their symptoms. And this usually, well, invariably happens within days of practice. So that's why Buteyko method became very much associated with asthma, because we actually began treating asthmatics. And we basically didn't really treat diabetes or high blood pressure or other diseases because our publicity and our initial exposure was with asthma. But Buteyko method is not specifically only for the treatment of asthma. It's for the treatment of chronic hyperventilation syndrome, which every asthmatic has. So anyway, not working?
I don't know what to do. I'm going to do something. Okay. Right. Right. Now it says we're pretty good.
All right.
If so many people left. Okay, go back on.
All right. Okay. Well, thank you very much for your patience. If you're still there and faithful to attempting to watch this, I do apologize for our technical difficulties. We're presently broadcasting from Bangkok, where they're having demonstrations, so sometimes our internet is a bit wobbly. Anyway, yeah, so Professor Buteyko suggested that we focus our attention on asthmatics with his method because the asthmatics get very quick results, and as a consequence, by the time authorities might want to catch us and put us in trouble, the patients are feeling very well, and instead of being cheated or abused or ripped off or in some way, you know, hoodwinked, they are claiming to have very good results, and they're very happy. And that's why we got so much publicity. We got so much publicity in newspapers, it got to an extent where some newspapers wouldn't even give us any more publicity because they were saying, well, you've already had so much, we just can't write yet another story about yet another asthmatic who's overcome their symptoms. Sydney Morning Herald, Women's Day, Women's Weekly, the Bulletin, all the capital city newspapers and so forth, all covered it. But one organisation in particular really didn't like us at all, and we sent invitations to the Asthma Foundation of New South Wales and Queensland and others, and they were not interested. Instead, they more or less just said that it's not approved, we haven't done the proper trials and so forth, and as a consequence, they can't recommend it, and in fact, they would warn their members that what we were doing was dangerous, even. Well, we never recommended people not to take their medications, but if you're not having symptoms, why would you take symptomatic medication? I mean, symptomatic medication should, according to its licensing agreements, be taken the same way you take aspirin for headache. If you're not having a headache, you wouldn't take aspirin. If you're not having tightness or wheeziness or spasms, why would you take a bronchodilator for if you're not having symptoms? And that's how our students were able to dramatically reduce their medications, because the reason for taking the medication was taken off. Well, there was a very famous, I think they're still going probably, television program called A Current Affair. And they came to our clinic, I believe, to more or less expose us as charging people lots of money to do an unproven therapy which doesn't have any scientific credibility. And they were basically, I think, well, they pretty much were going to bury us. And they came to our clinic with our teaching clinic in Edgecliff, with their cameras on their shoulders and ready to sort of march in there and, are you a doctor, and how much do you charge, and And you know, does it have you done medical trials? Is this proven? But they were good people, because when we said to them, hold on a second, why don't you talk to our patients? They'll tell you if this method is effective or not. And a current affair stopped what they were doing, began to investigate, and discovered that our patients are doing better. Our patients are taking less medication. Our patients are becoming free of their asthma symptoms. Well, that meant that turned around to the Asthma Foundation and these asthma charities, which were so opposed to us. And they began to put pressure on them to say, well, you guys should really do a trial of this. A trial should be done to see, is this method authentic, and therefore it should be promoted widely, or is it fraudulent and it should be killed stone dead? Well, we did the trial. I wrote, Professor Charles Mitchell and I had the responsibility to write the protocols of the trial, which we agreed upon. Professor Buteyko was still alive in those days, and he acted as our consultant and advised us how we should go about it. We did a double-blind randomized trial, which meant that we had two groups, one that did a placebo, like some useless, breathing exercises or some sort of techniques, and the other group did the Buteyko method. It was only a small group. However, it was a double randomized placebo trial, which meant that each individual on each in each group had to be paired. So in order, even just to get a dozen people or so into the trial, you had to interview hundreds and hundreds to make sure that you could have the identical groups. So anyway, the results were spectacular. I believe they were the best results ever recorded in medical history for the reversal of bronchial asthma. The Buteyko group was led by Tess Graham, and basically I would say there was an overall reduction of bronchodilator usage, 80 or 90%, something like that. And a few weeks later, during her follow-up sessions, they were even able to reduce their steroid medication. The control group, or the placebo group, they got basically nothing out of it. And so the results were there. And it was written up in the Australian Medical Journal and a few other medical journals. And we honestly believed that after these trials, we would get calls from hospitals, asthma clinics, doctors, government departments, insurance companies, research organizations. We had actually, not only did we have thousands and thousands of people and dozens of newspaper articles claiming that this method was effective, we now had the best results ever published in a medical journal in which all the objective tests were done, which showed that our students were able to be free of their asthma symptoms and to, get these extraordinary results. Well, how many calls do you think we received from university medical researchers, insurance companies, government departments, the Department of Health, asthma clinics and hospitals? It's a nice round number. 0. Not one authoritative mainstream medical organization was interested at all. They just ignored us. I was always told that, oh, it's all very well that you've got a theory which is consistent with the physiology, biochemistry and biology. It's all very well that you've got anecdotal claims of results from school teachers, housewives, mothers, fathers, children's doctors, lawyers, celebrities, politicians. It's all very well that you make these claims and you have all these testimonies, but without bona fide, without proper medical trials published in a medical journal, etc., etc., you won't be taken seriously. Well, we did that, and we weren't taken seriously. If you do your research, you can type into Google Buteyko medical trials, and you will see all these arguments. Oh, well, there weren't enough people, and it wasn't significant, and the objective tests weren't met, and all this kind of schmutter, basically, which they carried on with. But the reality was that our group, the Buteyko group, in that trial, were able to come off their medication over 80% reduction just within a few weeks. So, and it was all written up, the evidence was there, and basically authorities weren't interested. So, I can tell you, it is effective, it is hard work, it's not easy necessarily. I've been teaching this method for 20 years, more than 20 years now. Not one student that has come up to me and said, wow, I got great results and I found the method really easy and enjoyable. I think everyone finds it quite a challenge. You have to be disciplined, you have to practice, you have to follow instructions, you have to learn Buteyko's ideas, you have to put them into practice, you have to practice these breath-holding exercises, which are, well, there's one lady in England who apparently she claims to, I don't disbelieve her, but she claims to enjoy doing these Buteyko's breath-holding exercises, but she's the only one in my 20 years of teaching who has said to me, oh, I enjoy doing this breath-holding exercises. So I don't want to say to you that it's easy, but I do want to say that it's worth it. There's no need for any contemporary human being to be any longer poisoned with symptomatic bronchodilating medications. They can learn Buteyko method, they can practice, and they will start to see results within days. Not weeks, not months, within days you will begin to see improvement. Okay, that improvement might be small to begin with, but the improvement is authentic. So I would encourage anybody with asthma symptoms, shortness of breath, tight chest, and so forth, to look carefully at the Buteyko method. And naturally, as we're trying to bring this method online and to teach in groups online and so forth, notwithstanding our technical difficulties, that we'll do our best. We want more people to learn this method and to get the results which Professor Buteyko enabled us to do. So I guess there might be some questions. I should look on my iPad and see if there are any questions.
Not yet.
Not yet. Okay. Well, please feel free to ask any questions or to say hello. I mean, for 20 years, I've been, I taught in all the capital cities of Australia, Singapore, Indonesia, United States, UK. I worked in London for years, Holland, many cities in the Netherlands, Germany, all over the place. And I always had a group of people to talk to, and I could see if they were interested. I could try to answer their questions. And now with this extraordinary technology, I find myself in a room with my assistant Abner, who is doing all this, trying to keep all the technical side together, looking at a tiny camera. So it's a different experience for me. I hope that what I've said makes some sense. And I'm still waiting for some questions.
Just answer any questions about how it works.
Okay. Well, the question is, how does the method work? Well, most people believe that they breathe because they need oxygen. And you do need oxygen. But that's not why, that's not Your requirement for oxygen is not the main mechanical driver of respiration. What happens is this. When your alveoli and bronchus, lungs and so forth, has a concentration of carbon dioxide of around 6.5%, it sends a trigger to what's called the respiratory center, which is located in the medulla oblongata part of the brain. And that trigger causes the respiratory center to produce this feeling of suffocation or air hunger, and also to stimulate or provoke the intercostal muscles and vagus nerve system. So if you try to hold your breath, after a short while, you'll feel suffocation. You will feel, and maybe your diaphragm starts to be provoked and become very, starts to pulse somehow. That's not because of any kind of oxygen deficiency. That's because your respiratory center drives your breathing mechanism, and it's driven by the level of carbon dioxide. So we'll take a method. Yes, of course, we show you how you should breathe, and we coach you in that, and we encourage that. But Buteyko method essentially is about retraining this respiratory center. Because if you think about it, even if you do Buteyko exercises or any kind of a meditation, relaxation, you can only do that a certain number of hours a day, and there are 24 hours in a day. As a consequence, no matter how you try to change your breathing, if you don't change the sensitivity of your respiratory center, it will just rebound, and the homeostasis of normal gas values will reoccur, and you won't solve the problem. If, however, you learn Buteyko method and you manage to retrain your respiratory center with his breath holding exercises and certain changes to the lifestyle and so forth, then your breathing pattern changes. Your breathing becomes shallower, lighter, and the level of carbon dioxide begins to grow. This causes the bronchial tree to expand, and this causes the body to be enriched with CO2, and as a consequence of this, bronchospasms, tightness of chest, and asthma symptoms are no more required. So I heard some beeps on my iPad, which means maybe there are some questions. Ben asks, how long does it take to get rid of asthma? Well, I can't answer the question directly. I can say that you can begin to improve asthma, regardless of how severe, within days. But how long do you have to work to be completely free of it? I can give you some estimations. If you have sports-induced, very mild, occasional asthma, I think within 5 or 6 days of practicing, you will not anymore have asthma. If you regularly take Ventolin every day, once or twice, and occasionally you take Becotide or Pulmicort or these kinds of steroid medications, Serotype and so forth, maybe it will take 2 weeks of work, and your asthma will most likely be 70 or 80% reduced, and you won't really need symptomatic medication because you can overcome your own symptoms by doing the Buteyko method. And then over some period, your asthma fades away until it's a distant memory. If you're taking nebulizers, oral steroid, and a lot of it, you have what's called brittle and severe asthma. The most severe cases are called status asthmaticus, where basically the person is always in a state of massive hyperventilation. They have very strong asthma reflex, and they're constantly needing nebulizers, spacers. They have to take very powerful dilating medications. As a consequence, their adrenals are exhausted. They need to take 10, 20, 30, 50 milligrams of prednisone a day, and so forth. It could take months before you are, what one would say, free of asthma. as I said earlier, within days you can see that you're improving, that you can reduce the severity of your symptoms. And this is what we see consistently, the frequency and severity of asthma symptoms becoming less and less. Carolyn asks, can you explain why CO2 matters so much? Okay. CO2 stands for carbon dioxide. Carbon dioxide has a very bad name. Carbon dioxide is, considered a waste gas. Carbon dioxide, even in high school textbooks to this day, teach that we breathe in oxygen and we breathe out carbon dioxide. Like carbon dioxide is some kind of pollutant, some kind of a waste gas. Well, not only is that not true, it's a massive lie. It's a massive, it's a lie on the level of being a fraud. For those of you who are Trekkies, you would know that human beings are often referred to as carbon-based beings. Carbon dioxide is essentially within the genesis of organic life. No carbon dioxide, no life. In the human organism, CO2 gets split up into CO2, the gas, carbonate, bicarbonate, carbamate, and carbamate. It's split up into 5 forms, basically. CO2, according to the Bohr effect, this discovery made by the father of Niels Bohr. You may have heard of Niels Bohr, Nobel Prize winner and physicist. His father was Christian Bohr. And Christian Bohr, well, in the literature I see that he is sometimes called Swedish and sometimes called Danish, but anyway, he discovered that carbon dioxide actually causes oxygen to be released from blood into cells and tissue. So the functionality of oxygenation is linear to the level of carbon dioxide. If you have a low level of carbon dioxide, oxygen can't easily get off the blood into cells and tissue. So there's the first point. Carbon dioxide is essential for oxygenation of the body. Secondly, and this is not in order of occurrence, this is just in the order in which it comes to my mind. Carbon dioxide determines the pH, potential hydrogen of the organism. And the pH is not one measurement, it's many measurements. But this potential hydrogen in the organism, carbon dioxide essentially acts as the chief hormone of the body and the chief, the most potent, or it has the most influence on our potential hydrogen or proper acid-alkali balance. Now, many doctors and health practitioners are aware that that the pH of the organism is fundamental to its proper working and incidence of disease. So to have an optimal, you cannot have an optimal pH unless you have an optimal level of carbon dioxide, because the thing which influences potential hydrogen the most in the organism is the corresponding level of carbon dioxide, although that would be in the level of DCO3, dissolved carbon dioxide. Carbon dioxide, as far as the nervous system is concerned, determines the threshold of excitability of the nervous system. The more optimal the level of carbon dioxide, the more relaxed and calm the nervous system is. Carbon dioxide determines the aperture of all vessels, and this should be important for those suffering with asthma and other diseases in which bronchospasms, high blood pressure, migraine, I'm getting a bit off topic now, but for example, most heart conditions are an asthma of the heart. Migraine is an asthma of the brain. And this kind of asthma is spelled ASMA. The asthma which occurs in the bronchus is called bronchial asthma, but we added a T to it, and now we use the word more commonly to refer, it's commonly referred when you say asthma, you're referring to bronchial asthma. But actually an asthma is a much more common state of affairs in the organism when there's a deficiency of CO2. So the rate at which the antibody bonds to the antigen, which in effect is our immune system, is linear to the level of carbon dioxide. The rate at which neurons synapse with brain cells and facilitating proper functioning of the human brain is according to the level of carbon dioxide. So what have we got? Carbon dioxide determines oxygen uptake. Carbon dioxide determines a person's pH. Carbon dioxide determines the aperture of all vessels. Carbon dioxide determines how effective your immune system is. Carbon dioxide determines the excitability of the nervous system, and carbon dioxide determines mental predisposition and how well neurons will synapse with brain cells. So, apart from determining oxygen uptake, pH, all your hormonal activity and so forth, the aperture of all vessels, how well your intellect brain will function, and how well your immune system will function, carbon dioxide is described as a waste gas. This waste gas, which is essential for all biological life, all organic life, and which determines so many factors within the proper functioning of the organism, is widely known as a waste gas. So it's not a waste gas at all. In fact, it is essential to all life. And that is why the organism has so many defense and compensation mechanisms against the loss of carbon dioxide. And that's why this category of chronic diseases, asthma, allergies, angina, bronchitis, bronchiectasis, cystic fibrosis, diabetes mellitus, emphysema, hormonal problems, sleep apnea, the experience of hyperstress, if you will, snoring, and so many, these several hundred conditions only occur when the organism is deficient in its proper levels of carbon dioxide. I mean, the subject of carbon dioxide, I mean, just on the area of hormones, for example, there are 40 important, there are more than 40, but there are 40 very important hormones produced in the organism. And each hormone, you could have a book the size of a Bible written about it because it's so complex and so involved. And if you talk on the subject of carbon chemistry and carbon dioxide effect on the biology and the human organism, one could talk forever. The subject is almost endless. Aidan says, thank you, Christopher, for the info. What would you recommend for a chesty cough? I'd recommend that you check your control pause, that you measure your breathing, and that you learn Buteyko method. If you have a chesty cough, I can tell you this, regardless of how severe your chesty cough is, within 2 or 3 days of practice under proper tuition, training and so forth, either the cough will be completely gone or it'll be greatly reduced by at least, say, 50% or so. But as I don't know your underlying condition and what else is involved, I can't give you, tidbit advice. Doesn't really work. I can say that you shouldn't mouth breathe. I can say that you should avoid high protein food. I can say that you should breathe less. But the problem with breathing less is that if you try to breathe less, as soon as you stop volitionally and deliberately breathing less, the respiratory center will because of its homeostasis, it will compensate, and once again you will lose everything that you gained, you can lose. So a chesty cough, it's not difficult to solve out. It is not difficult to improve enormously within a few days, and depending on what is behind this chesty cough, is it just a little bit of asthma? Is it emphysema? Or is it just a little infection or something? So I can't say precisely how long it will take to solve, but improvement you can expect, and dramatic improvement within. As soon as you get your breath holding skills, as soon as you develop some skills and you deploy them, you will see Buteyko method is cause and effect. You work, you do the method, you practice it. You may not like practicing it too much, but the results come cause and effect. And usually within days, you'll notice significant improvement. So I think we draw to a close. I would like to thank everybody for paying attention and watching this presentation. This presentation was specifically targeted to those who suffer with asthma and allergies and so forth. And I'm hopeful that you'll take away some good news, that you might do some research on the internet, that you look for Buteyko trials, that you look at some articles that have been written in various newspapers, that if you wish to have a consultation with one of our facilitators or practitioners, you can do that, and you can ask more specific questions about your particular condition, because I can't answer in very general terms, perhaps well enough, so that you know exactly what you're getting yourself into. But in a consultation with myself or one of our practitioners or one of our facilitators, we can take a look at your case on a one-to-one basis, if you wish, and tell you pretty precisely exactly what you need to achieve, precisely how long it can take, what you can expect realistically in terms of being free of asthma symptoms and not having a tight chest, not having spasms, and being able to live a life free of asthma. Workshops. Yes, and we do have asthma workshop coming up. Those with mild condition, mild asthma, they can just do a basic Buteyko workshop. That'll be good enough. Those who take oral steroid and have rather serious asthma, they need medications to get through and so forth, I'd recommend they take the 2-week course. But I should emphasize, within 2 or 3 days, you'll know you've made the right decision. Within 2 or 3 days, nose is unblocked, chest is clearer. You may still get symptoms, but the severity and the frequency of the symptoms and your requirement for medication, you will find, is linear to your breath holding ability that we teach as part of Buteyko method. So, but before you make a decision, should you do the 1-week course or should you do a 2-week course, we'll be very happy to speak to you and explain. Some of you will want to join a workshop. Some of you might prefer individual coaching. Individual coaching is probably more convenient, but it's not necessarily better. All that matters is that you understand Professor Buteyko's ideas, that you employ them in your life, and that you do the exercises that he recommends and that we prescribe and explain, and that you develop your skills so that you can overcome your symptoms and so that you can retrain your respiratory center and so that you can be free of asthma. And the results, like I said, with some serious complicated diseases, it does happen that a person loses faith halfway through. There are reactions, there's cleansing reactions, there's difficulties, they lose faith a little bit, and they can fall off the wagon, if you will. But with asthma, it's not the case, because with asthma, within days, you get very, well, you might say, maybe the weather has improved. Maybe I haven't come across my allergic trigger or some such thing. But regardless, and you will see in the course of time, it's obvious that the better your breath holding ability is through the techniques that we teach and that you practice. You have to be a good student. You have to practice. It's easier for children. Their exercises are different than adults because their respiratory system is not developed yet. It's very good for kids. It's very good for middle age and even for elderly people. Everyone gets results according to this cause and effect pro rata work results and the resultant reduction in symptoms. We have another question here. Can the Buteyko method help epilepsy? Yes, it can. I've witnessed epilepsy being treated many times. In fact, most people believe that an epileptic attack just occurs very suddenly. It doesn't. The person with epilepsy, they're aware that things are starting to go in the wrong direction. And they can use Buteyko method to overcome the attacks. And as their pauses improve, and as their breath holding ability improves, and as their skills improve, their epilepsy diminishes in much the same way as does with asthma. Epilepsy is another kind of spasming disorder. Of course, the spasms occur mainly in the brain. So, yes, in answer to Billy, the answer is yes. The Buteyko method does indeed help epilepsy, although I would be encouraging you to do a 2-week program, not the simple program, because epilepsy is a deeper disease and there are often some complications that have to be solved out along the way. But does it work? The answer simply is yes. I think we've come to the end of our time, unless there's any more questions. No? Quite a quiet group. Well, I'd like to thank you very much for patiently listening to my talk on the Buteyko method and how it can be helpful for those who suffer with asthma and allergies. And I look forward to any questions, any queries. If you would like to have a consultation with a facilitator or a practitioner, or you have other conditions, emphysema, bronchitis, bronchiectasis, cystic fibrosis, diabetes, type 1 and type 2, epilepsy, chronic fatigue, all this category of chronic diseases, which used to be called the diseases of civilization. That's what the Buteyko method can positively impact. The last thing I'll say is that if you're interested in the Buteyko method, you should be ready to work, because it is work. Unfortunately, we can't do it for you. We can explain, encourage, consult, explain Buteyko's ideas and encourage you to do them and so forth, but actually you have to do the work, and it is work. Most people will need to practice 3 to 4 times a day for 15 to 20 minutes. You'll need to make some lifestyle changes. They're not that difficult, but maybe a little awkward sometimes. But within days and weeks, you can see significant improvement in your symptoms, and a person can begin to take control of their own health instead of be subject to the whims and this sort of traveling without a compass and without direction in the hope that your condition doesn't get worse. With Buteyko method, you can take concrete steps, work, and get the results that you want. And that, for the sort of person who is interested to work for their health, it's perfect. One more question. Okay.
Nocturnal seizures.
Yeah, does it help nocturnal seizures? The answer is yes. And I will talk a little bit about sleep. It's no coincidence, and you can check this with any hospital or any friend that you have who works in a hospital. You can ask them, when are the most admissions to the emergency ward of a hospital for stroke, for asthma, for severe asthma attacks, for heart attack? Where are the most admissions into psychiatric wards and so forth? They are between the hours of 3 a.m. and 6 a.m. And this is because when we go into the deepest level of unconsciousness, the breathing becomes the most deep. So if you're already breathing 3, 4, 5 times more than you should, and you're doing this 20 to 30,000 times a day, and then you go to sleep and your breathing becomes even deeper. We know this because you never see someone pushing their trolley in Tesco snoring. They may have sleep apnea. When they go to bed, they will snore. But when they're upright during the day, they won't snore. You don't have nocturnal seizures or those kinds of seizures when you're up and about during the day. So why should they happen at night time when you're asleep? And it's because your breathing deepens when you're asleep. And so when you learn Buteyko method, your breathing night and day changes. And even in the interim period before you change your breathing enough so that you're not having nocturnal seizures, there is a way to actually prevent them from occurring with Buteyko method. So the answer to your question, Patsy, does Buteyko method help with nocturnal seizures? The answer is yes, it does. Okay, so once again, we're signing off here at Buteyko TV, and I'd like to thank you very much for taking the time out to watch this presentation. I apologize for some of the technical difficulties that we had, and I thank you again for being patient with my presentation. I look forward to hearing from those of you who are interested in pursuing the Buteyko method, and I thank you all for paying attention. Good night.